done offline. In our case, the bottles are made within a few minutes or hours. We have to label it. Unlabeled bottle is very difficult and it's a voluminous product. If we run the plant for 3 days and if we don't label, the whole packing section and the quantity will get filled with bottles without label, and contents you can't distinguish visually. So every bottle that is made has to be labeled, and then only next batch is made. So we have to follow very strict guidance on that. During COVID time, workers were not coming on it, and in both the years we had to shut down the plant for 60 days. So it impacted us adversely. It was normalized, then we could again get to normal operation. Post-COVID, the usage pattern has changed a lot. There are two things that have changed. One is that more and more doctors started using IV fluid as a vehicle for medication. Earlier, if you remember, like 30-40 years back, IV fluid was given only when there is serious critical condition, otherwise not given. Now even vitamins are supposed to be administered for IV solution. So IV fluid is a very good vehicle. Typically in US or Europe, if a person is hospitalized, he will be administered 4 to 6 bottles at a time. In India that was not the case, but post-COVID I think that has come into practice because there are obvious advantages. Support the concept of administering 2 medications together. Like you will see combination drugs, one tablet having 2 actives, that government restricts now. Similarly, if like a person has to be given vitamin C, then if it is a 500 ml solution, they will give vitamin C. Then 100 ml again they will give another medication likewise. So the usage pattern has changed. So I hope I have answered your question in a limited way.
Hello, my question is how extensive is Amanta Healthcare global presence, and what are its strategy for expansion in different markets?
So our global footprint, it varies from therapy to therapy. For instance, Steadiport that we saw, or we are seeing here, is innovation that we were the first one to bring it to India, and it is India-centric. Having said that, we still export to markets like Kenya, but our main target audience will remain India. Talking about globally, respiratory care, for example, they are more focused in markets like Philippines and Vietnam and Thailand. Formulation injectables are more towards Africa and Southeast Asia. You must have seen eye irrigation product. We call it irrigation, but it's not nothing to do with irrigation, but it's eye and wound irrigation. It's used in phaco surgeries. That is primarily sold in UK, Ireland and Spain at the moment, and we will expand that in Europe and markets like Australia, New Zealand. So I will rephrase my answer to an extent. Whatever product portfolio we have developed and whatever geographic areas we are addressing, in the same geographies we would be able to add more therapeutic offerings. So primarily without geographic expansion also we can easily introduce new products, mainly in injectables and respiratory care products. Hope I answered the question.
Earlier the company was known as Mark Biosciences, so why there was a change in name to Amanta Healthcare?
So we all grew up in Anglophile environment, or we are probably product of that generation. So there was a tendency to give Anglo-Saxonic names earlier. So we also probably gave that name. When we started this company at that time, I did envisage that company would grow to this level and we will have registration in numerous countries. I don't think at the age of 26, at least I didn't have any vision. So, but then gradually company grew, we started registering products in numerous countries. Then a situation came that sometimes e-merc conference invoice will come to us. Our company will get confused with Markson. Likewise, there are 6 companies with similar sounding names. In 2013-14, we were introducing Steadiport. So, the container you see here, I will show you the sample also. So, Steadiport was innovative product. There were really strong product attributes. So we thought that this needs to be promoted, the concept has to be sold. It can be left to distribution channel. So our total field strength at that time was 20 people. We added 200. And that time we thought that we have this challenge of ambiguity about the corporate brand. We are spending so much money on Stereoport brand. So why not to use this opportunity to rebrand the company also? So because I think this is the first instance where the corporate brand was changed by piggybacking on the baby brand. Incidentally, this appeared as a case study in one Canadian management school. My friend son was studying there and he sent me the case study that here is a company which rebranded based on the initiatives or efforts they were putting on the baby brand. So to remove the ambiguity, we changed from Mark to Amanta, otherwise nothing else has changed.
Have you brought down the prices?
No, I think the NRV has not come down.
Okay.
I'll ask I'll address this.
So, sales compared to FY24 to 25
You are saying volume or per unit?
per unit. I'm talking about.
That's what I said, na?
No, not per unit. Total value 280 to 270. That's what you are referring to, right?
I am referring FY24 to FY25.
Correct.
Your cash from operating activity is 4662 as compared to FY24 580. And you have got no finished goods inventory. So we what stock will be liquidated.
This is because of the inventory of the last 15-20 days that has had some impact on the operating activity because the inventory was higher compared to last year. That's the reason.
So inventory is over, so the money will come in, na?
I think, but to that extent, that year's from EBITDA to that extent, money blocks into the current assets. To that extent, that is.
So the operating activity cash flow
Technology to stay ahead of its competitors and differentiate its product portfolio.
So our mainstay is integrating the product development, the molecular chemistry of the product, and fusing with the engineering, which is a process part. Process is very tricky. Here the container is manufactured in situ. At that time the temperature would be 100 °+ and then you are filling the solution. So most of the products are very susceptible to thermal shock. So product development in lab is lot easier than the tech transfer that we do to the manufacturing level. So that restricts our offering to an extent. But in spite of that, there are quite a few products that we have done. For example, paracetamol infusion in plastic container. We were the first ones to develop it and launch it in India. And it was licensed out to Pfizer and they marketed for more than 5 years till they sold the product to Abbott. Similarly, Pfizer wanted a product called Pedialyte. It was packed in glass bottles with a rubber stopper, with aluminum seal, and then a plastic dropper. So 5 kind of materials were coming in contact with the solution. We developed a tooling for them and gave a container with a peel-off kind of solution. And again, that was the kind of performing very well. So likewise, we are very strong in that part, process and tech transfer to the manufacturing level. We don't have very elaborate R&D at the moment. The reason being that there are very few products which are stable in plastic. But if something is stable in plastic, then that's the best way to go about it in terms of cost efficacy and product quality assurance. So our offerings, they remain confined to ophthalmics, respiratory care, and some injections in 100 ml. We were not putting much weight in product development till last year because there was no capacity addition. In last 7-8 years, whatever capacity addition we have seen is in Stereoport space. Now with this proceeds, we are going to add capacity SVP also. So that will increase our capacity in both small volume injections and respiratory care product. So now we have already preempted that by developing respirules for nebulizers and ophthalmic So that's what we call typically in pharma lingo product pipeline. So right now we are working on 20 products which are being developed and they will be commercialized once SVPs commission.
Any plans to
Manufacturing, we don't do plain vanilla contract manufacturing, meaning a company, a customer gives formulation, process know-how, material, and we just convert it, give it back to them. This is something which we don't do anymore. Either we develop a product and license out. If it's their formulation, then we develop the tooling for them. Sometimes our role is very restricted to stability study. So every product partnering relationship we have some role, significant role to play, which gives us traction. So it used to be 30-40% of revenue earlier, now it is 15%, because other businesses have grown faster than that. Post SVP expansion, our product partnering, as we call it, not contract manufacturing, that will also grow. So that's very dear to us, and it will see activity there for sure.
And given the geopolitical conditions and imposition of tariffs, so any risks and challenges faced by the company, and how do you mitigate it?
So we are not exposed to US market at all. So we are not impacted at this moment or even in near future. We have PIC approval. So PICS is a European initiative, and we always have been having PIC approval for last 12 years. Our focus will remain on PIC geographies which are far better, far more predictable than US market. So, and generally speaking, even those companies who are exporting to US, at the moment they're exempted from, pharma sector is exempted, but tomorrow even if something happens, I don't think any manufacturer will budge and pay someone else's taxes and take a hit in India. That's my broad view.
Any exports to Russia, Ukraine?
Russia, Ukraine we don't do. In Russia we do some ophthalmics, but not directly, through our channel partners who have registration there. So we have a very clear understanding about what to do and what not to do. We are averse to do any customer facing activity in a market where our presence is thin and channel partners are complex. So we don't do that. We always rely on product partnering and out licensing.
Thank you. We wish you success.
Thank you very much.
Congrats go to low risk to the high risk. And secondly, I also noticed that nobody in your board of directors have a medical background.
Yeah, that's the, I will answer the second question first. Not having medical background is a limitation. Your general appreciation about the disease management and therapeutic portfolio development gets restricted to an extent, I agree. But all these years there was no need for that. Mainly because what we were doing, in our plant we have more engineers than pharmacists, by the way. Because it's a fully automated engineering heavy process. So, and probably that's something which must have attracted me at that time because I have mechanical engineering background. But now that we are developing product pipeline, we are having scientists. We have dedicated formulation development department. By December, we will have a senior medical officer also, a doctor. He will be onboarded and advising on therapeutic basket development. So we would have that. Sorry, first question I will take that.
The classification of low and high risk
So,
relationship to this
yes.
field.
So, there are some solutions. They are classified under medical device category. We don't make device component as such. But from regulatory point of view, to make things simpler for the companies and for the regulatory bodies themselves, they have reclassified and put certain products under device category. So, for example, phacosurgery or nasal drops, they are sterile in nature, but all they have is salt. Regulator is not much concerned about the benefit of a product. They are mainly concerned about the side effect and how it can harm the patient. So if your product is demonstrating in clinical trial the benefit ranging from say 10% in certain population and 60% in some other population, they don't care. Whether 60% or 10%. But if they find that there is possibility of having a adverse reaction or some side effect, then they would not like it. So such benign products are reclassified and put under device category. So what we make is a solution for phacosurgery, deep wound irrigation, eye irrigation, but they're just classified as device. But we don't make component